Okay. So just give me 1 second as
Mhm.
well. Right. Good afternoon, everybody. This is Dr. Ashish, and we are live, usual for a live show every Friday. And I do have a wonderful expert guest today. I'm meeting Dr. Vandana also first time. I think we are going to have a chat. So, welcome, Vandana, and welcome to everybody else who connects with us. Today's topic is very, very relatable because it is about immunological issues in fertility or fertility journey that women go through. And there are so many things that women go through. How can we and what can we do from natural perspective, from Ayurvedic perspective? That's what we are going to talk. But first of all, hello, very warm Ayurvedic welcome to you, Vanna. Please tell us what you do, how long you've been doing this. I want to know what is you. Why did you become an Ayurvedic practitioner?
So, first of all, thank you so much for inviting. Thank you, Dr. Ashish. Namaste and welcome to all our viewers and whoever is listening. It is a great opportunity to have this conversation about fertility in women. It is a very important issue. It is like in Ayurveda, we talk about the life, what kind of life, living a satisfactory life, having this contentment of living this life. And for female, being a mother is actually one of the most important thing that brings them this content of being this. And I like to answer your question, how I came to this field of Ayurveda and especially to women health. I
Yeah.
specialize in women health. My MD from Banaras Hindu University is in Ayurvedic obstetrics and gynecology, that we call as Stri Rog and Prasuti Tantra. And that I completed in 98. And then for 3 years, I was senior resident there in the department. And before moving here, I was professor in SDM College of Ayurveda. I am also a published author of 2 books on women health.
So
Is
many things.
Yes, I have just been so passionate about women health, just living this life, being a feminine being, that I'm very excited to share all these things. So, one of the books is Ayurvedic Gynecology, is
Yeah.
titled Stri Rog Vimarsh, and another about Ayurvedic obstetrics is titled Prasuti Tantra Sandarshini. They are from Chokamba Prakashan.
Yeah.
And how I came to Ayurveda is very interesting. Uh,
Mhm.
I guess I have never talked about it on any live platform.
Please tell us because I'm interested in the story. What happened?
Yes. So I come from Banaras. Banaras is actually one of the ancient cities, and it is considered the seat of spiritual wisdom. And growing up, I have been very fortunate. In ancient time, it used to be a kingdom, Kashi. So there
Yeah.
is a Kashi Naresh. He lives in Ramnagar, that is across the river Ganges. Their fort is there still. It is a very attractive tourist place. And the Vaidya in ancient times, there used to be Vaidyas. So the Raj Vaidya, they happen to be our family friends. For they trace their history to 13 generation being Vaidya.
Wow.
That's a
Fantastic.
lot, century. It spans more than a century.
Yeah.
uh, and our family has been for past 4 generations friends, my great grandfather, my grandfather, my father, and still my brothers. We are very close knit family, and whenever we used to have any problem, the first thing was to go to them. And when I was very young, I was suffering from tonsillitis. And I mean, we used to go to Vaidyaji, but we also used to visit doctor. And
Yeah.
what happened that I was advised tonsillectomy. It was like tonsillitis was moving towards from inflammation to abscess. And I
Yeah.
was very young. I was in fourth or fifth class, like in India we call class the grades here,
Yeah.
elementary school. And the conversation was moving towards the removal of the tonsil, tonsillectomy surgery.
Yeah.
And I was so scared. Then my grandmom suggested that let's try and visit Vaidyaji once. He gave me one tablet that I had to take only with warm milk at bedtime.
Mm.
Later, I asked him what was the tablet, and he told me Kafketu Vati. It is a rasa ushadhi. So I just had to take it. Was a tiny tablet, round. I mean, not the tablet, goli that we call round vati, with warm milk. I took it for 5 6 months. Actually, it was long time uh, taking that Ayurvedic medicine. But that day and today, after completing that therapy, I've never suffered from tonsillitis. This is a spring season, and last night also we went out. and had ice cream. I eat whatever I want. I mean, it is not just I'm indiscriminately eating. I'm Ayurveda practitioner. I'm very discriminate and conscious about what I eat. But
Yeah.
still, when I want to, sometimes I indulge myself. But how the health of my upper, yeah, I should say the urdhva jatrugat that we call.
Yeah. Yeah.
Tonsillitis is the organ, urdhva jatrugat, above the clavicle. So
Hmm.
I have never suffered from tonsillitis again in my life. And while growing up, like from fifth grade to coming to 10th and then 12th class, I was so impressed with Ayurveda, so impressed that I got my seat through CPMT, and all my family was against me joining for BMS because it's
Yeah.
kind of a known fact that it is not considered a coveted profession in
Yeah.
India.
Yeah.
We want to, as a first choice, want to go to MBBS. So this also is very informative for our global audience, how Ayurveda is in
Yeah.
India, how it is perceived as a social uh, acceptance and as a profession. It has never had this. And if you permit me, I will share a little bit about history of
Please do. Please
this.
do. Yes, yes, yes. I know because I have not story like you, but I just bumped into Ayurveda
Oh,
by accident.
so for me, it has been a very conscious choice. And
Yeah.
going to women health has also been a very conscious choice. So when I'm so much interested in Ayurveda, I always go deeper and try to find out why Ayurveda is not so accepted and not respected in the society as a profession. So I came across that when British Empire was trying to rule India, they have been there for a long time and they
Yeah.
couldn't break down this country. So Lord Macaulay traveled to the length and breadth of India. He was assigned this job, find out the cause, how to break this country, the people. He
Yeah.
traveled, and in his report, it is a history, written history, documented, published paper, that he presented his report that as long as they have their indigenous system of knowledge, it would be hard to break them down. So, British Empire made so many things illegal, including the practice of Ayurveda. With one order, like in those days, it was a Farman. They issued this order: the practice of Ayurveda is illegal, and they
Yeah.
established kind of made broad medical profession in India and established first medical college in Calcutta, now called Kolkata.
Yeah.
So that's how Ayurveda started facing its demise. Eventually, it was illegal to practice, and people for generations have practiced that, but it's continued to go towards its decline
Yeah.
because it is not accepted. It was made illegal. It was not supported by the ruling government. And unfortunately, after the independence of India, the government has never supported. This is the first time after the independence of history in the history of Ayurveda that first time this government has started advocating for Ayurveda, promoting, uh, kind of allocating budget required for its growth in India and abroad.
Yes.
For the first time, Ayush Ministry have a secretary who comes from Ayurveda and is not an IAS officer. You know, these things out of India, many people do not know.
Yeah.
They
Yeah.
feel that why it is indigenous knowledge. I get asked this question: why it is indigenous and why it is not practiced? Why it is step child treatment in India? How
Yeah.
come it is like that?
Yeah. It
So, so this
I
is
used to be more involved with this because, we originally we have Ayurvedic Practitioners Association here. When it was set up, we were like founding members and initially did all the work. So I was involved with APA for a long time, and also knew about all this, what was going on kind of politically within Ayurveda. Now for last few years, I'm more concentrating on my business or work or patients, and not necessarily involved with that. But it is, I think I mean, I can talk about this whole day because it's such a contentious thing to talk about. Why are we not doing enough for Ayurvedic medicine in India? I mean, I also see, because I work a lot with fertility, I see that IVF clinics in India, every IVF clinic should be using Ayurvedic medicine because you can prepare patients so well, but they don't. Or any other health condition where we are not using Ayurvedic resources well. What we are doing with that, we are making it so superficial in terms of just using herbs. Herbs is just one factor. You need to change your lifestyle, you need to change your diet, you need to do all of that, which nobody's interested. So it has almost become like a third thing, which is Ayurvedic supplements, and Ayurvedic supplement, everybody is taking Ayurvedic supplements and they think they're doing Ayurvedic medicine, which they are not. Actually, yesterday I spoke to a patient and she said she has taken some Ayurvedic herbs, and I said, okay, last year she did that for fertility. And I said, so you are living Ayurvedic way since? She said, no, right? So she only took herbs, but didn't understand about personality type or the dosha type or the constitution and how and what foods to eat, right? So that is, it's a huge issue for me, and that is why we are doing this, so that we can raise it. We can raise the standard of an Ayurvedic practitioner. You and I, if we have to, and I don't want to do this because I don't like comparisons, we have more knowledge and information than a medical doctor, you know and it's a given fact. I know this because I know I'm more qualified, but because it is not in the mainstream, people don't look at you like that. And people think, oh, this is just, oh, even Ayurvedic doctors think, oh, I'm just only an Ayurvedic doctor. We trained, you trained, and I trained same way. Ayurvedic medicine, we trained, we used to do all the medical tests, lab tests, all the dissection. I did all of that, what medical students do, so I have this issue that why do we not feel as prestigious about Ayurvedic medicine? And I only bumped into Ayurveda, but only when I came into UK in 1998 and started doing herbal medicine degree. And actually, first day when I went into herbal medicine class, uh, students asked me, okay, so what have you done? Because most of the students were mature students, and they said, what have you done? I said, I'm an Ayurvedic doctor. And they said, what are you doing here? You should be teaching us. And it started to dawn on me that what I have is actually really something amazing. And I never acknowledged or never knew it because this is not how it is seen, Now things have changed a little bit in all these years. I'm talking about going 30 years back, but now things have changed a little bit. I've met other Ayurvedic doctors who feel more, prestige about. They feel good about it that they are Ayurvedic practitioners. But yes, I understand what you're talking about when we talk about Ayush. I don't think it has done enough, and I know because I know the inside story.
You actually touch so many things. We so much connect on this thought. There is so much to talk about it. What is Ayurveda, how it should be practiced, where it is at the global level, how we can educate, regularize and standardize Ayurvedic medicines and have credentialing for Ayurvedic education. I
Yeah,
mean, we can, like you said, we can sit and talk day long about all these issues. There is so much that needs to be done. But for me, from my uh, kind of, when you moved to UK in 98, that was the time I completed my MD and I started practicing Ayurveda.
yeah,
So the thing is, I totally connect to what you are saying, how people are practicing Ayurveda.
yeah,
Today, Ayurveda has become just Ayurvedic medicine. I also get, because I specialize in women health and infertility as well, I have good success rate. And people come to me referred by or just word to mouth. I do not do any marketing, but I always have. And people come to me that I have tried Ayurvedic medicine, it didn't work for me. What else you can do for me? What
yeah,
you do? And when the same question that you asked, are you living an Ayurvedic way of life? Uh, Herbs are or formulations are one part of Ayurveda. So we
yeah,
are going into this kind of conversation sitting in America. I want to say that whatever we are discussing is for educational purpose and information sharing, and we are not making any recommendations here for people to follow or do anything.
yeah,
It is just a conversation because we are experts in our field. We are having this conversation about this Ayurveda and Ayurveda practice, and people do not understand that if body, which is the ground for the herbs and formulation to work, is not ready, it will not work. So the powerful tools of Ayurveda are not just herbs and formulation, it is preparing the body, and how we prepare is by our routine.
yeah,
This routine is so important that Ayurveda calls dincharya, swasthavrit. It starts with the routine, and then food, eating guidelines, how we eat and digest.
Yeah.
Then comes the number of herbs,
It
right?
is. It
And
is.
if it doesn't works, people think that if it doesn't works, they have to go for panchakarma. But panchakarma is part of preventative as well as therapeutic aspect. So in infertility or for women health, panchakarma is very important. So
Yeah.
these all are kind of need to be considered and taken into account, and not just Ayurvedic herbs and formulations.
Yes, yes, absolutely. I talk about this, and like you, because I do a lot of work online, and I am connected with a lot of people, and a lot of social media lives and stuff. It is um, every time somebody is saying, okay, I used herbs, or I did something, or I used a therapy, it didn't work, and my next question is, how did you use it? Did you go to a practitioner to take your herbs? Because if you're taking herbs just online, or you're taking herbs buying from health food shop, that's not Ayurvedic herbs, that's not Ayurvedic medicine, that's not herbal medicine. Medicine is when you go to a practitioner who then assess you and give you proper medication and change things about you, so that you are then living in the right way going forward. But there is so much that has to be said about this, and we know that with fertility also, we're going to talk about the immunological side of it as well, but there is so much that is it's a lifestyle based issue, and fertility is not only women's health issue, it's men's health issue as well, equally 50-50, which is what women don't even realize. And they don't even, because I think one of the things, I don't know if you have seen this in your practice, but one of the things that I see, for example, that when men have got their parameters about sperm health, so the numbers, the motility, the morphology, and we are looking at only low numbers as long as it is within the range. Yeah, my thing is, if the pregnancy is already not happening, you've been trying for a year or 2 years, yeah, the woman is trying to do certain things, we need to do so much more with the men, because their lowest markers are not good enough. That means it's not working for them. Yeah, what do you say?
Yes, I totally agree with that. I agree with that. There, it is not just about the lowest markers, it is about so many things.
Yep.
We should not just look up at the semen, sperm count, or its physical characteristics or function. We also need it would be a very reductionist approach.
Yep.
We actually need to look about the holistic way, that even when all these physical markers or reports are normal, it is not happening because we are not looking up at them as a person, as a couple.
Yep.
Is I One thing I want to add, it is not just individual thing for men and women, it is not only just for the couple, it is also for the society, how they are supported. If they are both in a family, they both are working and earning members, the
Yep.
stress and support of the family at the time also counts. So
Yep.
is a issue bigger than just looking up at the numbers or the reports. And like before, you were saying immunological issue, and we were talking about the lifestyle. There's a connection, and I choose this topic very consciously because in Ayurveda, this immunological aspect of immunity is very much connected to what we eat, how we digest, and how our body is digesting, metabolizing, processing it, the
Yep.
elimination of the waste at the digestive and metabolic level,
Yep.
because it is very much connected to creation of these toxins that we call ama in our body,
Hmm.
right? So immunological issues are very much related to the thing that we are talking about, the holistic approach. Because people can choose, there are food that supports fertility, and sometimes my yogis tell me that I'm following all these things, I am taking that supports fertility, I am taking my lifestyle is good and everything. When I look up at it from Ayurvedic aspect, I will give you one example, one very simple example. Even
Yep.
if they are choosing the food that supports fertility, their for a female, menstrual cycle is regular, by this is kind of an indicator that ovulation might be normal, regular
Yep.
cycle and having no problems. And
Mm.
for men, the report says they are young. It is not that they have crossed 40, they are of adequate age and they have been trying, but it is not happening. What happens this is just one example, that
Yeah.
the food that they are eating, how they are eating, and how their body is processing.
Mhm.
If they are not doing this mindfully, if see the connection of mind and body, Ayurveda has always said, modern science is proving it now, how
Yeah.
our mind affects our digestion is, the first thing is that the enteric nervous system, it have more than 600 to 800 billion neurons, right? And it is called enteric nervous system. Now for past decade, modern medicine has started calling it the second brain,
Okay.
because the nature of the cells is as brain cells. So what
Yeah.
happens here affects here. If you are
Yeah.
not mindful, if you are not calm, if you are not aware of your environment while eating, it all affects you, and it affects your digestion, because mind affects how the cells are perceiving food and digesting it. The second is the vagus nerve, the largest nerve of the central nervous system. It does many things. It also have its role in digestion, and the role in digestion is 20% come from brain through vagus nerves to the gut, but it is 80% that goes from the gut to the brain. What is happening here affects here. And the
Yes.
third are neurotransmitters. There are 600, 300 to 400, or maybe 600 uh, neurotransmitters that our gut makes. And
Yep.
how it will make correct, these neurotransmitters are the substances, chemicals, enzymes that kind of regulate, control, and control the outcome of the various processes inside the body,
Yep.
right? So if we are simple one thing, how we are eating and how we are digesting, the mind and gut connection affects. And in Ayurveda we know that there are four important things for fertility, right? Ritu,
Yeah.
Ambu, Beach. And Ambu is the nutritive elements. When we digest our food well, then
Mhm.
this nutritive elements of the body are kind of optimal, that support fertility. Beej, these are sperm and ovum.
Yep.
The, that we call Shuddha. That means they have normal physical, chemical, and physiological characteristics only when body is digesting well, and through the metabolic process. After the digestion, this is a seven-step metabolic process in Ayurveda, where sugar and uh, beej are formed in a female and male,
Yeah.
right? Ovum and sperm. So if ras dhatu is not correct, rakt is not correct, metabolism is not correct, when food is not digested well, ras is not correct. It
Yeah.
is the precursor for all tissues c- and metabolic processes. When that is not correct, how we expect the ovum and sperm to be able to give the outcome of our, I mean, support fertility.
Yeah.
So it kind of boils down to Ayurvedic food, eating, digesting, metabolizing. Here,
Yeah.
I mean, the daily routine affects how we digest, what time we eat. It
Yeah.
is so important, right?
Absolutely. It's all of it. It's amazing, and you are explaining so well, which is fantastic. Starting from where does it actually start from? And yes, those numbers are probably the last thing, but that's the first thing that patients see. Because they are not aware of all that what you are explaining and what you and I know, that this is where it needs to start from. And also, what I have seen, especially to do with fertility, is that there is so much mismatch in terms of energy of partners, sexual energy of partners. And most of the time, they're not on the same page, which is why they're not connecting at the right time. And that is why one reason that pregnancy is not happening, as well as that there are so many sexual health issues with men. ED and premature ejaculation is quite common. And that is also, I find, probably is one of the reasons why the pregnancy wasn't happening in the first place. But let's say something about, the actual topic that we are talking about as well. So what kind of issues you see, with immunological health, and what do people come to you with?
I get various kind of cases where infertility is concerned, male infertility as well as uh, issues with male and issues with female. Uh, disorder ED is one of the very common disorders.
Yeah.
where people think that we do not want to go the route of taking medicines, or sometimes do not find result and come to Ayurveda. And quality, and especially the motility of the sperms and number of the sperms, for that they come. And actually, the one thing that you mentioned first is incompatibility, or that alignment of energy is not there. They themselves do not understand, but when I sit down in the consultation, we help them see that problem. Most of the time they have not been told by their doctor, or they themselves do not recognize it, or they do not kind of acknowledge it. So when we bring it in their awareness and offer them with those solutions, that becomes very important. And
Mhm.
actually, when we are talking about the immunological issues in the infertility, how common it is, out of 5 couples, one suffer from the immunological
Yeah.
infertility. And
Yeah.
in male and female, it is 53% of the male have immunological infertility. The study says it is only affecting only 36% of the female. And most of the time it happens that, like, I will share one of the examples from my recent rogi, that they found nothing wrong with the female. She was having healthy menstrual cycle, and all the uh, uh, kind of blood work, hormones, everything was showing normal. There
Yeah.
was only one problem. They could see that there were presence of the natural killer cells. The number was high. The cutoff is 10%, and she has 27%. So
Yeah.
she was told that since there is no issue, male is normal, female is normal, it could be the reason. It could be the reason, and it is not the reason, because women who have this cell number high also conceive. So they didn't had the clue what to do.
Yeah.
They and they started exploring holistic health and alternative medicine, because in the modern, the only route was to take some corticosteroids. And these days everybody is aware of its effect.
Immune suppressants.
Yes, yes, that was the only thing they had, that for to use for that couple, and they
Yeah.
didn't want to. And it was a long-term therapy, maybe 3 to 6 months, and that too, there was no assurance associated with that it will give result, because they were not sure it is the cause. When
Yeah.
they came to Ayurveda, during Ayurvedic assessment, I could see that there was lots of ama. And because it was an American couple, they were not aware of this aspect of their being.
Yeah.
So helping them just come, but they were very open to try. So helping them get aligned to it
Yeah.
helped.
Yeah.
And the couple conceived. They had come to me with 4 cycles of IVF ET failure.
Yeah.
You know, IVF, embryo transfer failure, the conception was not happening, fertilization was happening, the body
Yeah.
was not accepting, and they had no clue why it was happening. And 4 is the limit, 4 cycles they try. After that, they tell couple that it is not working. So
Mhm.
it is, couple want to have a child. It makes their life miserable when actually when a couple is set that they want. And uh, they do not know where to go.
Yeah.
So I see Ayurveda, like you have said in the beginning, that Ayurveda should be the part of every infertility center, is so important
Yeah.
for this society to understand, to create the demand, because medical world is highly prejudiced towards Ayurveda. You're giving the example of India, so I would say that from my experience and the news, that medical world is highly prejudiced. It could be the thing that they are afraid that once people understand the power of Ayurveda, they would be sidelined and it will become the mainstream.
Of course. Of course. That's what
It
they're
is
afraid of.
also
That we are
about
taking
pharma
their.
industries, and the it is all about money, everything. Nobody cares about the people.
Exactly, is the point actually. But no, that's a good example, and I see this as well, related to natural killer cells, or there is something else. There is thicker blood, for example, that women are taking. And so many women are taking dispirin just out of, okay, somebody else mentioned it, they start taking dispirin. It's like as if it's a candy. You start taking it, without really truly understanding. And I also feel that immunological issue is also related because it is related to your emotions, it is related to your stress factor. How are you perceiving and how does your body take stress? Because it is almost like body going into this autoimmune reaction, you know. As well as when couples energy doesn't match, we know that so many women are they don't accept antibodies of the sperm, so there may be that reaction as well, which is very common. But it is understanding that which they don't. And the worst thing you can do is then use immunosuppressant. I had a case many years now, this is probably 10 years ago. That boy is 8 or 9 years old. She only came to me towards the end of the therapy, but she wasn't using my work was only to do the therapy part of it. But this is somebody who had used 10 cycles of IVF. Okay, 10 cycles. I just didn't know what to say. Um, and on the cycle, when she met me, that was the 10th cycle. Okay. They were going abroad, they were not having it here in the UK. And she was on immunosuppressant drugs, all immunosuppressant drugs. Okay. So she had a baby boy. When she delivered, the whole body came up with a reaction. She had huge boils all over her skin. I cannot imagine how doctors never inquire or they never look into, okay, what else can we do apart from it, suppressing somebody's immune system just for the sake of it, where we have got so many natural ways to deal with that. And I mean, that patient is fine now, but she wanted to have another child, but because she had got this huge trauma of just even getting have one child, that I don't think she doesn't have any more kids, but that's the only one. But this is what happened with her. And I think so many women and couples, they lose the sight that yes, you do want the child, but child is only going to be there if you are alive, you know. If you have your health compromised to that point that you're using so many chemicals, what kind of quality we are producing for that child themselves? What kind of, you know?
Because in Ayurveda it says that we have Prakriti, and how Prakriti is formed. It
Yep,
is the Panch Mahabhutas or doshas from sperm and ovum, Arthav and Shonit come together.
yep,
But it is also affected by the ahar and vihar of the mother after conception,
yep,
right? So if a mother is so sick or is on so many medication, there are so many imbalances, the health of the newborn is going to be compromised. It is not just the health, the prakriti, and prakriti is the inherent being
yep,
of that person.
yep,
That person would be born with these kind of problems in their constitution, that all their life may not live a healthy normal life. That in Ayurveda we call some dosha, some agnisha, some dhatu malkira. It will not be there, imbalances would be there,
yep.
right? That would be so inherent to that person that prasanna atmendriya mana will never happen. So
I don't think they even
Mm,
anywhere
yes,
close
and the
to that.
first thing for me, I my first approach is always Prakriti assessment, helping them understand
Yeah,
how to be in balance, how to be swast, like how who they are and how to create balance. Because when they are not in balance, so Vata Pitta Kapha affects the Agni,
yep,
and how it creates ama, and how we correlate ama to the immunological immunity in the body or immunological reactions in the body. We
yep.
are talking about immunological aspects of the infertility.
Yeah.
So I will just a little bit elaborate on that.
Yes, please.
When
Yep.
vata dosha is out of order for a person, suppose person is vata and their vata is vitiated, then what happens that it affects their agni. And agni, like vata, is the energy of mobility. It may enlight the fire sometimes and suppress it, so food will not be digested well, and it will create kind of in actually the is of three types: amvish and garvish. So when this food is not digested well, then it is kind of a general umbrella term but when it is in the blood, rakta dhatu, we may consider it is the lipid. Suppose
Yep.
it is the joints, may consider like arthritis, we may consider it some kind of uh, disruption in the mechanism of the joints, like fluid or membrane, something is happening. So when it affects the organ, Then we call metabolic waste. We just name it at digestive level, at metabolic level also It is an umbrella term, but it creates the toxin that actually sometimes body reacts to it as these toxins are exogenous and endogenous.
Yeah.
Sometimes becomes an endogenous toxin against which our immunological reaction body becomes hypersensitive to that,
Yes.
right? And when a person is in that state where ama is working as an endotoxin, body is reacting to that. In this compromised state, when the person is trying for conception, it affects because the state of the body is in a charged state, attacking mode, right?
Correct.
It is
Correct.
not in a receptive mode or conceptive mode. Conception doesn't happens in vata imbalance, in kapha imbalance, because agni becomes mand. It itself creates so much ama, and ama is a sticky slimy substance, body cannot expel it on its own. Then the same process may happen. It may work like endotoxin. Or when pitta is there, so pitta, the fire is ignited sharper. So after digesting the food, it may start working and destroying the cells and tissue. The body have more of the debris, like what and kind of free radicals can do in the body, or chemicals, or toxins, or pesticides can do to the body is creating on its own. This create high pitta energy is destroying cells and tissues, creating debris inside the cellular waste in the body.
Yeah.
That becomes ama, to which body becomes hypersensitive and reactive because it works like an endotoxin. And the body will not be in a receptive mode of conception. So you see, just being out of balance of the doshas, vata, pitta, kapha state can affect our digestion, create ama, which can cause problem. So in Ayurveda, it is seen as like a what? Just prakriti, what we need to do with that. But you see how important it is to be in the balance.
I-
So balance of the vata pitta kapha is very important, and for that again we will go back to what person needs to do,
yeah.
their food and eating guidelines, and their routine and lifestyle. Because a vata person is drinking and consuming cold drinks, cold beverages, or simply sipping on the cold water while eating,
Yeah.
or just indulging in cold food, e- eating salad every day. That
Yes.
too, raw food directly taken out from the fridge, doing late nights, watching so much of TV, or just being on the screen. These are all vata aggravating factors. So, what we are doing, we are just helping them understand.
Yeah.
See, this is what you are doing wrong. They fail to correlate. They have been to such big infertility centers, so many labs, investigations, and now we have simplified it, and it is so economical to practice. You
It
see,
is. Yes, yes. I think it's just because when you don't know what you don't know, then you don't know what to do about it, because patients
true.
are going through so many tests, especially to do with immunological tests, and they're very expensive as well for patients to, and especially I think in America because everything is private, so they are just through the roof. And my point is always this: you can test everything, but then you're still not able to give the solution. You can keep testing immunological tests, and then everything related to, okay, NK cells are more or less, or whatever else is happening. But then what solution are you giving? Apart from immunosuppressants or corticosteroids of any kind, what other solution there is? Or you're giving Disprin to patients. You don't want to start your conception with so much medication. I mean, IVF itself is such a huge hormonal thing because it is, hormones through the roof that are given. And I think they have even increased much more than what, for example, I had 15, 16 years ago. There are many more hormonal medications that are given now. But at least whatever we can do to prepare them really, really well, or we can simplify. Because my thing is, and I think it probably is also comes from Ayurvedic understanding of body, is that how can we simplify this? How can I understand this in more simpler version rather than patients who come with their whole file, which has got test and test reports, and still not getting anywhere with it?
True. And here one very important thing is calming them down. Counseling becomes very important.
Yeah.
This state of anxiety, hopelessness, fear, it it is very damaging. So in my consultation I include and give very important part to it, and that comes into the part of the lifestyle. I give
Mhm.
immense importance to, after dosha balancing discussion, I give immense kind of simultaneously it goes on. These are not two separate things, that how they live their life, their routine, ayurvedic routine. Ayurveda has always said routine is important, dinacharya. And in 2017, Nobel Prize was given to the scientist who proved it at molecular level,
Yeah.
right? So certain parts of our body are aligned to the rhythm of the nature, and their function is optimal at certain times. So person who wakes up early, like in Ayurveda it is said brahmurte uttishte, they are going to have natural elimination supported by a panvayu, that is colon transit time is optimal at the time. There is one research to support that as well.
Yeah.
So when healthy elimination is happening, this body is not designed to hold the waste and you start eating the next day. People are going any time of the day or having elimination at the night time, and they think that this is normal. According to Ayurveda, regulating the biological cycle of the body, so that when they wake up in the morning and having a healthy bowel movement before they start putting food in their mouth on that day is very important. So regularizing the cycles, bringing them in alignment with the natural rhythms, which we call Ayurvedic dinacharya,
Yeah.
is very important part of immunological infertility, to create this balance and make this body fit for the healthy conception,
Yeah.
free
Yeah.
from these internal endotoxins that we call ama, at digestive level or at cellular metabolic level. So dinacharya is very important part, and I incorporate in dinacharya meditation, yoga, going to bed on time, and sleep rituals for the couple to be free from the anxiety, calm, and be ready for the conception.
Yeah.
It is not that you work whole day how you want, you eat and then you go to the bed late and do it as a physical activity for conception. It doesn't works. It is
Yeah.
not holistic. It is, and conception is also a very spiritual process. It is not in our hand. So when in an ayurvedic routine we incorporate all these things and eventually bring them to have faith in the universal energies and divine beings, the blessings of which are actually very important part of it, it actually helps. It
Yes. Yes.
helps them be ready, connect to the universe.
I think this is yeah. I mean, I do the similar things in my practice as well, not just for fertility, but for rejuvenation or any other condition as well, because you have to start from doing the right thing and putting the right system in place so that you are forever healthy. It's not just only talking about health now. And I think one thing that people miss in their fertility journey is like, okay, I'm not getting pregnant, I'm not getting pregnant, I'm not getting pregnant. But it's not just only getting pregnant. You have to stay pregnant. You have to stay healthy during pregnancy. You have to have a child who is then healthy afterwards. We know that children have more autoimmune conditions now. We know that children who they have got so many more skin conditions. They have got so many more. We are diagnosing them on.
Simply
Sorry.
food allergies. So many
Exactly.
food
There's so
allergies.
many of them. Yes,
That
yes. Food
young
allergies.
kids are having food allergy. Where it is coming from? Of course, the system is we and so much processed food is there, GMO food is there, but some inherent strength should be there in the body to have this digestive capacity to eat and digest. They
Yeah,
do not have that minimal also. So this is affecting. And the third thing I would like to say, after like dosha balancing, working with the routine food and eating guidelines,
yeah,
although it is very restricted in United States of America, but while practicing in India, panchakarma was an integral part of preconception routine. It has two purposes. It
mm,
is not only to cleanse the body, It is also, Ayurveda strives to have a better progeny. I'm sorry. So it
That's,
is not just to cleanse the body, prepare for conception. It
yeah,
is to have a better progeny. Like you were just saying that food kids who are born these days have so many immunological issues or allergy issues. To have a healthy child who is free from all these,
yeah,
we need to have healthy tissues in the body of the mother and the father. And for that, Panchkarma is the best route. We do not have any such therapies in, I don't know, my knowledge is limited for other things.
we don't.
Other
Panchkarma is beautiful, unique to Ayurveda.
This
And
is so unique to Ayurveda, and
yeah,
where immunological immunity is concerned, or similar kind of problems which affect fertility is concerned, Panchkarma is actually one of the gifts of Ayurveda to this
yeah,
word that can be actually used for therapeutic purposes, and every infertility clinic should have that.
I know.
We are
I'm
speaking about.
rooting for that. That's what I'm also. Yeah, that's what I would love every clinic to start from Panchkarma. I do Panchkarma a lot here in the UK in however minimal way we can use it, but using those principles of Panchkarma and doing those therapies as well to help them, to get started on that. But it is one of my most favorite part of Ayurveda.
Yes, and especially when we are working with fertility, it becomes very important
Yeah,
because just dosha balancing, living a healthy life, or herbs formulations are not going to work if body is full of these toxins, which
yeah,
actually needs to be eliminated. Ayurveda says that with some doshas need to be forcefully eliminated,
yeah,
and for that they are adherent and stuck. So we have to help them with panchkarma.
yeah,
So panchkarma is actually very important part of this, and practicing in India I have seen results like for some couples immediately after
yeah,
panchkarma in the next cycle they would conceive, or within 2 cycles they would conceive
yeah,
like magic. It works like it gives wonderful result. There are so many published studies to
yeah.
support that panchkarma increases the chances of fertility.
It
And
is.
when we are talking about Ayurvedic Aushadhi, like many people say that I have been taking Falsarpi, I have been taking
Yeah,
Falgrit and Shatavari, or there are many formulations that they would say that I have been taking and it didn't work for me. So body needs to be ready for those herbs to work on your body, because these are rasa and rasa Aushadhi. They work at the rasa level. If the body is full of ama, you do not have that. Agni is very important, right? If you do not have that digestive strength or dhatvagni to process those correctly, then they are just herbs. They might be doing something, but they are not giving the result that we want. So before we start taking these rasayana aushadhi that research says that are good for fertility, the body needs to be ready to eat, digest, process, and reap its benefit. So these panchakarma helps prepare the body for these rasayana aushadhi as well,
yeah,
which we
yeah.
to
I think
medicine.
if somebody has to, I like to simplify Ayurveda a lot because obviously not everybody understands the concepts of doshas, and it is quite mystical. So, and somebody who is listening it to the first time. But one of the things that, like, one simplification is that you can take as many supplements or Ayurvedic medication or anything, but if your gut is not digesting it, then you're not getting any benefit from it, which is the same thing what we say. Your gut needs to be in that form, to be simpler form. It's ready so that that nutrition that you're getting from herbs is actually going somewhere, is doing something at the rasa level. So that is one explanation that I give, which is more simpler explanation, rather than, sometimes you can't do all the work that you want to do with patients, because patients come at different levels. Not everybody is going to come and have panchkarma with us. I would like to do panchkarma with every fertility patient, but they're
And
not going to
not
come.
just fertility patients, the parents also need. Once they conceive, after that, parents also need. Ayurveda says that it is seasonal panchakarma helps people
Oh,
age
absolutely.
well.
Yes,
You
every
know,
season. Yeah.
so
Yeah.
It is not just infertile couple, but panchkarma as a way of life everybody needs, but it becomes so very therapeutic and important during infertility.
Yes, absolutely. I mean, this is the season of Panchkarma now, so everybody should be going in for a Panchkarma session. But yes, one of the things that I would love to do is to take patients, back to India and do full Panchkarma with them. So that is one of my ideas. That obviously only certain couples can do that because it's a long, huge trek. Plus, Panchkarma is a very long program as well, but it is like many other things. But this is really wonderful to be talking about, what how I am doing things here, and similar to what you're doing, and how we are working on getting the system right, so that it's not just only now you get pregnant, but you stay healthier forever afterwards. One of the things I always say to my patients, it's like, okay, once you have the children, you need more energy to run around them, so you need your health much more afterwards.
And Ashish, before that, after delivery, the postpartum care is so important. They need energy for that as well.
Right.
Delivery compromises the body, the loss of blood, and Ayurveda says that the loss of the dhatu. So the conception and carrying the baby for 9 months compromises the health of the mother. So
Yeah.
after delivery, how the care is taken and how they are, postpartum depression is so
It
prevalent.
is. Yeah.
If you
Yeah.
look at the studies, it is shocking how many women suffer from that. So in Ayurveda, when we offer these powerful tools, it is not just for the conception.
Yeah.
Actually, people need to understand that. That's why we call Ayurveda holistic. It is not just addressing one issue, it is making your life better. What
Yeah.
happens to you after you conceive, during pregnancy, it supports. What happens after delivery, it supports lactation, postpartum recovery, coming back to normal health. And then your life with your child, it makes it more enjoyable. So
Yeah.
Ayurveda is truly holistic in its approach, and it is so simple to practice. You know, what we have been discussing, if someone will think that, wow, what they are talking about, they are just saying, follow this routine, eat
Yeah.
this food, and if possible, just go for Panchkarma. This is
It is. Yeah.
everywhere. You
I
go to
think
the
it's,
internet.
yeah.
This is the thing that is required.
It is. I mean, Ayurveda, and that's when I share and discuss with other people. They're like, what is the difference between other holistic medicine or this medicine? How is Ayurveda different or better? And you and I know it's a complete system, because you don't have to, if you look at patient from fully ayurvedic perspective, you don't need anything else. Everything will make sense in terms of doshas, everything will make sense in terms of agni, everything will make sense in terms of what you can see, again, with doshas and dhatus and everything. And there is so much that you can do by changing even simple things. They look really, really simple, and people think, how is this going to help me, in getting pregnant, or in creating the, like, quality of egg is one of the things that everybody is like, okay, the quality of the egg, the quality, because they are told by doctors, because IVF clinics have got nothing else to tell them. So it's like, because of your age, your egg quality is this, and that's why this is not happening. And one of my patients said, I'm sick of listening to this sentence. Everybody talks about your egg quality is not there. And she said, in my country, everybody's getting pregnant at 40, 45, and it's not even an issue. But here, everybody is just saying to me how bad the quality of my eggs is, because we are not looking at certain basics of health,
True,
basics of
true,
holistic.
fully agree.
uh, yeah.
So, yes, what we talk about is all your daily routine, your lifestyle, what you are eating, how you are eating, when you should be eating, how much you should be eating, when you should be sleeping, meditating, all these, just mindfulness. So, actually, this is what life is about, what we do from morning to night. We wake
Yes.
up, we work. Of course, professional work is important, but how we sustain and support ourselves is food, how
Yeah.
we exercise, how we sleep. So those are the basic things that Ayurveda teaches us, but it is holistic. One person cannot solve their problem just by following Ayurvedic dinacharya lifestyle.
Yeah.
it is a holistic approach where the same person have to follow the food and eating guidelines, the same person have to follow the other things that are suitable
Yeah.
for that case, like undergoing panchkarma or taking some herbal formulation. So
Yeah.
it is a comprehensive plan we work with, and not just one thing,
No.
and that too designed for that person. It is very important to emphasize that every individual is unique, and we create that plan and program for that person.
Absolutely. I think we have run out of time.
Sure, it was great talking to you. Thank you so much, Dr. Ashish.
Oh, you're very welcome. And thank you so much for sharing this. And there is so much to speak about this. We'll talk another time, another topic as well. But thank you so
Sure.
much for being here and sharing your knowledge, your practical experience, because that's what we need to highlight more, that there is some help out there. Only because from medical sense you have not been helped so far, there is so much help that ayurvedic medicine can do, natural medicine can do, but go to a practitioner who can properly see you and assess you, and don't just take herbs over the counter, which is my one of big contentions with people. My friend told me or somebody else told me, and that's why I'm taking these. So so great. Thank you so much for listening to you, for being here, and also listening to your story, how you became an I oh where the inspiration came from. So thank you, Dr. Vandana. Thank you so much.
Thank you, Ashish, and thank you to all our listeners and viewers. They can shoot us their questions if they have any at our emails, if
Yeah.
you share with them. Feel
Yeah,
free
I
to
will
reach
share
out to
your.
us if you have any questions or any problems.
Yeah.
We just want all of you to know, don't be hopeless. Ayurveda is a true science. It
Yeah.
is not just traditional, or it is not just ancient. It has been continuously been in practice, and it is itself proves it has withstood the test of the time. It
Yeah.
is just that some clinical parameters, because it is a different kind of science, cannot be proved by the modern science. That is
Agree.
the modern science limitation, not Ayurveda's. So Ayurveda is in itself a science, right? So
Yes. Yes.
feel free to reach out to us if you have any questions.
Yes.
Thank you
Thank
so much.
you so much. Thank you.
Namaste.
Bye.
Bye bye.